Hello, my name is Amanda Griswold, and I am the Quality Performance Specialist for the Oakland and Northern regions. This presentation is about the ACO preventative health measures. This slide is a quick overview of each of the 6 preventative measures: influenza immunization, tobacco use screening and cessation intervention, screening for depression and follow-up plan, colorectal cancer screening, breast cancer screening, and statin therapy for the prevention and treatment of cardiovascular disease. These measures are part of our reporting requirements during our ACO quality submission each year. While reviewing the table, you can see the different metric specifications, timeframes in which the measures must be completed, and the expected goals CMS has given. During the following slides, we will take a closer look into each of these measures with suggestions on how to improve our overall success. The first measure is influenza immunization. This is for patient aged 6 months or older. For the 2020 reporting year, the vaccine must be given at the office between August 1st of 2019 and March 31st of 2020. Or document in the chart that the patient received the vaccine at a different location. The ways to improve this measure are to make sure to document immunizations done outside of the office, places such as other providers, pharmacies, or health fairs. The more information documented, the better. Document any patient who is refusing the vaccine. And lastly, utilize a population health registry or yearly checklist. Tobacco use screening and cessation intervention. This measure is for patients 18 years and older who were screened for tobacco use 1 or more times within 24 months and received tobacco cessation intervention if identified as a tobacco user. Please note this includes any type of tobacco, including smokeless, like e-cigarettes and vaping. The ways to improve this measure are: ask and document tobacco usage at every visit. Make sure to document that cessation counseling occurred. Prescribing medications to help nicotine addiction will also close this measure. I have included 2 different resources available that can be given to patients: smokefree.gov and 1-800-QUIT-NOW. Screening for depression and follow-up plan. This measure includes patients 12 years and older who were screened for depression using an appropriate standardized depression screening tool, like a PHQ-2 and/or PHQ-9. If positive, a follow-up plan must be documented on the date of the positive screening. Ways to improve this measure are: complete the screening yearly, either during the first visit of the year or during the patient's yearly wellness exam. Embed the screening tool into your EHR. And lastly, use a population health registry or a yearly checklist. The next measure is colorectal cancer screening. This measure is for patients between the ages of 50 and 75 with a colorectal screening completed. I have listed the approved screenings that will close this measure with the timeframes the screening must be completed. Please note that the following patients will be excluded from this measure, but there must be documentation in the chart: any patient with colorectal cancer, patients who have had a total colectomy, patients living in a skilled nursing facility, or patients with advanced illness and frailty. Ways to improve this measure are: use every visit as an opportunity to review and order screenings if needed. At every visit, ask the patient if they have had the screening done. If they have, please have the patient fill out a record release form to request a copy of the report. And lastly, use a population health registry or yearly checklist. Breast cancer screening. This is for women between the ages of 50 and 74 who have had 1 or more mammograms anytime during the time period of October 1st, 2018 and December 31st, 2020. Exclusion for this measure include bilateral mastectomy, living in a skilled nursing facility, or advanced illness and frailty. Ways to improve this measure are use every visit as an opportunity to review and order screenings if needed. At every visit, ask the patient if they've had the screening done. If they have, please have the patient fill out a records release form to request a copy of the report. Outreach to patients, and partner with a McLaren Breast Center or mammogram department to help with outreach and coordination of care. And lastly, use a population health registry or yearly checklist. The last measure is statin therapy for the prevention and treatment of cardiovascular disease. This measure is for patients considered at high risk for cardiovascular events who are prescribed or were on statin therapy during the measurement period. Please review the exclusions listed here. Ways to improve this measure are ensuring that the patients are filling their medications and taking as prescribed, and also educate the patients on the importance of still showing their insurance card to the pharmacy so that a claim can be billed, even if they are receiving the medication through a free or low cost prescription program. Throughout this presentation, I have mentioned documentation. Documentation is a key role in the submission of quality because, as we all know in the medical field, unless it is documented, it did not happen. Within the medical record, documentation needs to be clear and complete of all screenings and treatment plans. Successful documentation should adhere to MEET guidelines. MEET is the heart of HCC and clinical documentation and is defined as follows. M is for monitoring, E is for evaluating, A is for assessing, and T is for treatment. Here are some key takeaways to help improve preventative services. Use every visit as an opportunity. Think of every patient every time. Yearly AWV or annual wellness visit, using the AWV form or yearly checklist. Use a population health registry to help identify services needed. Use first visit of the year as an AWV or schedule the AWV around the patient's birthday each year. Or you can schedule the next visit while the patient is in the office as an AWV. At every visit, ask the patient if they have been anywhere else, especially for the colorectal and mammogram screenings. Have patients fill out the medical record release to help get the report in the chart. Clear and complete documentation of screenings and treatment plans. And lastly, successful documentation should adhere to MEET guidelines. If you are a specialist and normally do not do primary care, you may be saying, how does this relate to me? Here are some ways that you can help. Make sure to obtain the patient's PCP. Refer back to the patient's PCP for yearly wellness exam. You can also implement feasible measures into your workflow, such as tobacco assessment and influenza vaccines. Make sure to document in the patient's progress notes. And you can also send consultations back to the PCP after every visit. If you would like more information or have any questions, please feel free to reach out to the Manager of Quality, Dina Miracle. You can also reach out to your Regional Quality Performance Specialist, which I have listed here, or simply send an email to our general email box. Thank you.